Hello everyone and welcome back to Herky the Cavalier's channel. My name is Mai, this is Herky, and this is Milton. And if you like my t-shirt, it says Cavology, and if you didn't know, Cavology is the study of unconditional love. This is our new line of t-shirts, and if you're interested in visiting our new website, it's cavalogy.com. I'll leave the info you need to know down in the description box below. And if you don't follow the girls on Instagram, we have a Herky here, proudly displaying our Instagram, Herky the Cavalier. Yay! She's super proud because it's her name and it's your Instagram. Alright, so today I wanted to talk about a subject that's really relevant now that we're well into spring and almost into summer, and that is ticks. You've probably heard about ticks, and I'm not a professional by any means, and anything I say on this channel is for information purposes only. I of course advise that you consult your vet for any medication or for further information. So ticks are little insects from the arachnids class. I don't know if I'm pronouncing that correctly, but basically they're little insects that latch onto animals or to humans also, and then they suck the blood from your dog. And why you want to look out for that is because they can transmit diseases. They're also known to latch onto deers, and that's why they ultimately can transmit diseases to your dog and to humans also. You can look out for ticks in woody areas, grassy areas, any forest, fields. They're particularly common in the US. There's a lot of areas that are infested with ticks right now, so I would advise that you check your local information to see if there's any notices out for ticks. They're starting to become more and more common here in Canada, and we've actually had a tick experience with Milton last summer, but we were in New York, but I'll get into that story in a moment. So the areas you want to avoid obviously is grassy areas. Just be careful whenever your dog is also chewing on grass, because ticks can also be hiding in grass and then end up in your dog's mouth. So when we were visiting New York last summer, just on a pit stop coming back from New York, so pit stops are really short. It's usually just we park, we make them pee just around, and then we go back in the car and drive. We actually found a tick on Milton's face right from that little walk, and it was very scary and very disgusting, but we were able to remove it pretty fast. But a few days later, we actually found a second tick on her back. So that's why I'm saying be careful, because they can hide in areas that are more difficult for you to see. And that's also something very important, is that you should check your dog after every walk. And I know that's a bit intense, but you really want to prevent any tick bites, because diseases can be transmitted within 3 to 6 hours that a tick was latched onto your dog. And why you should be careful for tick bites is they can actually transmit diseases that are pretty harmful for your dog, such as Lyme disease. That's the most common one, and it's the one that we want to look out for the most. That disease can cause stiffness, swollen joints, loss of appetite, fever, and fatigue. And when it's left untreated, it can be even worse symptoms. However, if you are able to detect it pretty early on, then it can be treated with antibiotics. But even then, you still want to avoid your dog getting fever or anything. So our vet always suggests, and we also go by that, to use tick prevention medication. This is going to be Herky's 3rd year on tick prevention. The first 2 years we use Advantix, which is a topical solution. It basically comes in little capsules, and it's an oil. So you actually put that between your dog's shoulder blades and along the spine as well. So it's an oil, it's going to absorb on the surface of the skin everywhere on your dog, and your dog basically becomes a shield for ticks. That medication is topical, so it actually kills the ticks and also fleas on contact. It protects against Lone Star tick, black-legged tick, American dog tick, and brown tick as well, and offers some flea protection also. A lot of vets prefer giving Advantix, I feel, because it kills the ticks on contact and you don't need to bother about tick bites. However, Advantix is not recommended if you have a cat at home, since it is toxic for cats. Milton last year also did Advantix, but we decided this year to change to another medication just because they did not react very well to Advantix last year, and that's just because it's a topical solution. So we noticed that they became very, very itchy on their back every time we used Advantix on them, and they always felt like scratching their back, and Milton was acting very frantic each time we gave them the solution, and she would really not enjoy, and she felt very uncomfortable on her back. She kept wanting to scratch her back and was unable to actually relieve that itch. So that's why we're switching this year to an oral solution, which is Nexgard. So our treatments this year actually come in a pack like this. We have the Nexgard for the ticks, But we also have the HeartGard, which we take every year, and that's for heartworm prevention. So the girls are actually due to have their first chewable tablet of Nexgard today, and I'm actually going to use just one box because both of them have the same dosage since they're in the same weight bracket. So I'm going to show you what it looks like. I opened it on the wrong side. It looks like it's pretty small, and it's smaller than the HeartGard that we usually give them. So these are soft chewable tablets basically, and they're really small. They're about this big, and they smell really strong like beef. Herky, who's Milton? That's Milton, that's right. Good girls. So Advantix is usually recommended for pups over 8 weeks of age and at least 4 pounds, whereas Nexgard is okay for puppies as young as 7 weeks old, but still at least 4 pounds. After you give them any sort of medication like this, you should also watch for any side effects. It's normal that they'll feel lethargic after, so if their activity and excitement level is reduced, don't be alarmed. It's probably because of this. So as you can see, they like the taste of their Nexgard. And now I wanted to touch on how to remove a tick. You can see that a tick is really small when it's not attached on your dog, but once it attaches on your dog and it has a drip of blood, its body is going to get really enlarged, which is really gross. And of course, a reflex when you see a tick on your dog is to just yank it out, but you have to be really careful how you remove it, because if it's yanked out too quickly or too abruptly, the teeth of the ticks can still latch onto your dog's skin and stay buried underneath the skin. You won't even be able to see it. And the right technique to do it is to take either a pair of really thin tweezers and grab the tick's head as close as possible to the skin and then remove it in an upright and steady movement. You can also find these kind of devices to help you remove ticks, or your vet may also have some instruments to help you remove the tick. This is from Zen Pet. And this is a double pack. Actually, there's 2 sizes of tweezers inside. They say this is a safe and easy way to remove ticks. You hook, you twist, and you lift. It says that it allows you to remove ticks without leaving mouth parts of the tick in the skin, without squeezing the tick, thus reducing the risk of infection, and there's no chemicals. It's quickless and painless. This is actually something that you should ask your vet also, because I've heard that you shouldn't twist the tick when removing it, so just make sure you double check on that. But I've heard that the 2 techniques are either these kind of devices or the tweezers, and you grab the tick really close to the skin and then remove in one swift movement. When we found the tick on Milton's face, we were just able to flick it away because it hadn't even had time to bite or latch onto anything. But the one on her back, we were actually able to remove with tweezers, and it was really gross. After that, we went to the vet, and they said that after a tick bites, you can only test for Lyme disease about 6 months after. So we waited after all that period, and then she didn't have any symptoms, so we're just gonna keep her on the tick medication, and she should be fine according to me. But if you have any doubt whatsoever, please go check your vet and ask for any testing to be done. And please note that Lyme disease can also cause paralysis, so you want to watch out for that. So you should take tick prevention medication for as long as there isn't snow on the ground. So here in Montreal, Canada, the vets used to recommend 6 months a year to be on tick medication, but right now, since there's less and less snow, they recommend using tick prevention for up to 9 months per year. So just check on those areas. If there's no snow in your area, perhaps you should even go on 12 months per year. Lastly, my tip to prevent any ticks and tick bites is to always check your dog, as I mentioned. After any walk, just pass your fingers through any skin area and look in the ears, in the mouth, and just look for any sort of bump. And if there's a bump, usually there could be a tick, but just watch out and be careful. So that's it for our tick prevention video. I hope this was helpful. If you have any questions, please leave them down below and we'll do our best to answer your questions. And of course, don't forget to subscribe, hit that notification bell, and thanks for watching. We love you and we'll see you soon. Bye!